this week for me of birthdays makes me think about time marching on, you know, the cycle of life. Time keeps moving. And in the last week, there have been some really sad messages on social media from people saying things like, I couldn't go to a funeral in May because of the lockdown, or I couldn't celebrate a birthday. And there are people talking about passages of time and, you know, really intimate human rituals they couldn't celebrate because of lockdown, while Downing Street were having parties. Now, everyone's already talking about this, and I'm actually not really that interested in whether they have parties. The bit that I really want to draw attention to before we start talking about backpedaling is that all those people at Downing Street had the data, all the data at their fingertips. They had a lot more than you and me, Mike. They've got all of it. So when I'm sending off emails asking who's in hospital with COVID, of COVID, what percentage of beds are used, etc., and I get no replies and I hit brick walls, they had that data. And yet they were still at parties. So what does that tell you? That the data didn't terrify them. So unlike the ads they were putting out telling you, you know, hanging out in Park Hills, or don't let a cup of coffee cost lives, or act like you've got it.
Well, I don't know whether you saw that tweet I read out from earlier, which was a Metropolitan Police tweet, which basically said, you know, have a great time, enjoy the lovely weather, as long as 1, you're on your own, or 2, you're only with one other person having a picnic, or 3, you're only with the people in your household.
Yeah, the rule of 1. Exactly.
Rule of 1.
I think people have forgotten how tough it was back then. You know, somebody got fined. I think it was by South Yorkshire Police. They were some of the worst police offenders. For somebody got into trouble for having a cup of tea with a neighbour. You know, it was one person having a cup of tea with a neighbour. Maybe they were both
They
going,
were sending drones
crackers.
up, do you remember? They were sending drones up to track people walking in the countryside, you know, in the open air, which was meant to be safe, according to, you know, anybody who was in Downing Street. But of course it wasn't safe if you weren't in Downing Street.
Exactly. So at the heart of this is the fact that officials at the highest level were not scared to go to a party. They weren't scared because they knew that risk was very connected to age and identifiable clinical conditions. We weren't all equally at risk. Otherwise, they never would have gone to a party.
No.
And I think that is interesting context for some backpedaling I want to talk about. I think we're at quite an interesting time now. We're sort of poised betwixt the great backpedal, which has started,
It has.
and the determined double down.
Yes.
We're at this point in between where people are beginning to kind of row back.
Yeah, because the double downers haven't got much to rely on. Their rock, or their iceberg, if you like, is melting swiftly around them, and it's beginning to look like they might sink if they stay on it. So they're thinking, should I jump over to that one? Because that one might be easier to rely on.
I would say what's propped up that side, where we're seeing the determined double down, is an assumed moral superiority. That lockdowns made sense because we were behaving in collective solidarity with everybody. But more and more as time goes on...
Except it turns out we weren't.
And more and more as time goes on and as harms become known, that assumed moral superiority looks more shaky. So there's a lot of backpedaling going on at the moment. I mean, it's quite something. I've been kind of collecting examples from across both sides of the pond. And the CDC has been very interesting on backpedaling. So the CDC director, Rochelle Walensky, said just the other day that 75% of COVID deaths had at least 4 comorbidities. And they were unwell to begin with. Now, this isn't great news to some of us who were following the data from the beginning. But it sounds
because
like
they consistently denied that, didn't they? They said that everybody was at the same level of risk, which clearly isn't the case. And we had Francis Hoare on the other week, and he said the numbers, and you'll know this, I'm sure, below 60, the number of people who died from COVID, as best as we can tell, is around about 640, who did not have comorbidities and who were not suffering from some vulnerability. 600 and something.
So this is a real backpedal. This is a clawback. But on one side, you've got this kind of doubling down. Oh, well, you know, they were really unwell to begin with. That doesn't mean that those deaths aren't sad, or they might not have been avoidable, or they could have had better treatment, or that the vaccine isn't going to help people like that now. It doesn't negate any of that, but it's still a double down. But on a backpedal, but it is juxtaposed with some fabulous double downing. The BBC put out a video just the other day trying to illustrate what 150,000 deaths looks like, because it can be quite hard to understand the scale. How many people have died of COVID?
They didn't do that football stadium thing again, did they?
They did. They showed young people in stadia. It's kind of like a fun, buzzy type video. There's lots of young people. And this is interesting because, first of all, it's not all young people that died. So they're using imagery which would give you the idea that it's lots of young people that died. That's not true.
Right.
The other thing is there's nothing in this video about providing context. So how many died with COVID? How many died from COVID? You just quoted those figures that Francis Hall was talking about. But then there's also this misleading impression of the young people that died, and how many people died from other causes, how many other excess deaths. You know, now do a video for excess deaths at home. So for me, this was like a blatant piece of propaganda. I'm not sure what it was designed to achieve, because it's from a news organisation. So where was the context?
Yes.
How many people die every day? How many people die over a year? Are there any other diseases where we collect the deaths over seasons rather than
Well, I can
by
help you out
year?
there, because only yesterday I was drawn to a figure from the deaths on the weekend, week 51 of 2021, ending on Christmas Eve, 24th of December, 800 and something deaths from COVID. Do you know how many deaths altogether?
No.
Over 13,000. So literally COVID was less than 7%.
Yeah.
But you wouldn't know that looking at the news, and you wouldn't know that listening to the politicians, and you certainly wouldn't know it listening to Chris Whitty.
So I would say, if we're going to talk about the number of people that have died, let's provide some context, some information, and balance it out so that people have got a wider understanding of this number. It feels like it was really to bolster fear, and it just didn't provide any scale. So that's backpedaling balanced with double downing. Another piece of backpedaling from the CDC again, which is interesting. They've come out and said that the PCR test can be positive for up to 12 weeks, which means, of course, it's not a very helpful indication of whether you're infectious. Now, again, some of us knew this all along. This shouldn't be news, but it's being offered up as news now. Now, the PCR test does what it does, and that's fine. It tells you if you were infected or if you're currently infected, but you don't know how infectious you currently are, because it's a very sensitive test. So that's fine. But it has been used in order to determine self-isolation.
Yes.
So it's not been used for all the correct
purposes. And they keep moving the dial on that as well, don't they? Because now they're saying, well, maybe we can reduce the amount of time you can isolate. And you go, well, why? And they can't explain why. They think maybe you're not as live with the infection for as many days as they thought, which means that was wrong then, doesn't it?
Well, yes, that was going to be my next one about the self-isolation. So I think in the States, self-isolation has been reduced to 5 days in most instances. It actually makes a lot of sense, because you're most infectious for a day or two before symptoms and for 2 or 3 days after symptoms.
Right.
I think there's a figure they quoted, up to 90% of all transmission occurs within a 5-day window. So that makes sense, but that's not what we've been doing. And any voices that called out for a different approach to the length of self-isolation, or understanding that PCR tests to a degree contain false positives, because they might tell you you're positive 3 months after you had an infection, all those voices were shouted down. So on one hand, the backpedaling is good, but on the other hand, there were people who were really dismissed and views that were stifled for nearly 2 years.
Yes, and many of them were people who couldn't then work, or for whatever reason were kind of, made into pariahs, in the same way that people are trying to make Novak Djokovic into some kind of pariah. I mean, Steve has sent this in. He says, a question for Laura. Do you think the incessant talk of booster, and Omicron being less deadly is actually having a negative effect on booster uptake? I'm sure that's true.
I'm sure it is, and I've actually written about this multiple times, started with my book and in a few articles since, on The Spectator if you want to look them up. Once the government started using fear, it didn't really have anywhere else to go. They are picking out the toughest, the most egregious tool in the toolbox to force compliance. When you've been threatening people with these frightening ideas about a virus, where do you come back? So, for instance, they never said that Omicron was mild anywhere.
Well, in fact, quite the reverse. I mean, I was calling for Chris Whitty not only to come out and apologise, but possibly to resign yesterday, because he said before Christmas, he basically killed off all Christmas parties, all hospitality, by saying you must prioritise your socialising, because we don't know much about Omicron, but what we do know is all bad. Those were his words, right? Yes. And there was a tsunami of infections coming. These are words that you know very well they're using for effect. Tidal wave was the word that a phrase that Boris Johnson used a few days earlier. And there was nothing in their locker, if you like, which was actually real, because they refused to take account of the South African data. They said it wasn't relevant. for some reason. Now it turns out it was exactly relevant.
Yeah. Well, fables, allegories, parables, they all serve very important purposes. There's a famous one, The Boy Who Cried Wolf. The UK government and our chief medical officers have cried wolf several times. Obviously, if you keep doing it, yes, I agree with Steve, it affects public trust. It may well be affecting the booster programme. So we hear different messages about the booster. It's going really well. And then we hear, there's 300 spaces left this week. Or
it's going really well. We've only got 200,000 infections today. And you go, well, they can't be both, can it? And here's the question I keep asking people, which I can't get an answer to. If you say that the two previous injections, the vaccinations, have worn off, like 1 and 2, if you haven't had them, is there any point in having them, or do you just go straight to 3? And you can't get you ask any medical governmental scientist, and they can't answer that. I don't know. Is the answer?
It's so.
Do you need to get 1, 2, and before you get 3, or do you just go straight to 3? Do not pass go.
Are they not the same anyway?
Well, no, because the third one's apparently different.
Is it?
Usually.
Well, if you had AstraZeneca the first 2 times, the third one is different.
Yeah.
It's now Pfizer.
Yeah.
I don't know. I have to be careful commenting on the vaccine itself. I don't really understand the efficaciousness of it at all, but I do think that exaggerating the scale of the threat has made people lose trust.
Yes, because people can only be told to cry wolf once, and the second time the wolf comes, it might eat them, but it doesn't mean they're going to care. Yeah, and the point is I'm simply asking questions. I'm not questioning whether it's any good.
You're not.
But they don't let you do that because nobody gives you the answer. Yeah. I mean, look at Sajid Javid when he met the doctor who hadn't been vaccinated. And when the doctor said, I've got antibodies, Sajid Javid, all he could come back with was, well, that'll wear off as well.
Okay.
As well as what?
That's on my list of backpedaling. Let's fast forward to this backpedal. Now, I thought that was a very interesting little conversation, but I probably couldn't be much more cynical than I'm at now after having looked at propaganda, media communications, the public health messaging all the way through. And I thought, was this entirely coincidental, or did Kings deliberately put that doctor right where the interview would take place?
Yes.
Did Sajid Javid know he was going to be there? Who knows?
Yeah.
Who knows what kind of
I don't think he
level
did.
of staging might have happened?
Well, because if they staged it, surely Sajid Javid would have looked better than he did.
Oh, I think he could have looked worse. I think he handled it pretty well on the fly.
No, he handled it well, but the point is that you came away from that conversation thinking, well, they've both got a pretty good point, haven't they?
Well, I think Steve Jones had a good point. I'm afraid I don't agree with Sajid Javid at all mandating vaccines for healthcare workers.
No, but what I'm saying is that he didn't dismiss him out of hand. He didn't say, well, you should get your vaccine and you therefore are a bad person, which is what he could have done. He
said that's your view, but it's not just his view. There was a House of Lords report that also concluded the same thing, that there isn't enough evidence for mandating vaccines for healthcare workers. Like Dr. Steve Jones said, the science isn't there. But I did wonder if that's laying a little bit of groundwork for clawing back on mandating vaccines for NHS health workers.
Well, you mean they might not do it?
Who knows?
I think they will actually, because I think they can't afford to do it, because we keep hearing, again, 2 mixed messages, because you get the BMA lot and the kind of lefties in the NHS saying, oh, well, the thing is everybody wants to leave, we can't recruit anybody, but at the same time we want everyone vaccinated. And you go, well, hang on, by wanting that and by sacking people who don't have a vaccine, then you're losing even more people. Why would you do that?
It does appear that unions have driven a lot about this,
yes.
And we could mention that in relation to masks in a sec. There's another type of backpedaling that's going on at the moment. It was big news this week that T cells, that's a type of memory immunity protection from common colds, have helped protect some people from COVID infection. And this was heralded as new and exciting, fresh news this week. It's not new news at all. This was being talked about quite early in the pandemic, but again, those voices were really stifled and shouted down. By the time I published my book, there were actually 6 studies into the importance of T-cell immunity against COVID. That means you could have had previous coronavirus infections and you may not get COVID, or at least it may improve the severity of the infection.
Yeah.
There's another reason that really matters. The imperial modelling in the original modelling that said up to 500,000 people could die didn't take T-cell immunity into account.
Right.
So T-cell immunity doesn't just mean you might be protected against COVID, it also affects that herd immunity threshold.
Yes.
So this should have been a conversation.
And also
all
it
the
might
way through.
explain why so many people are affected so differently, because we all know people who have had it more than once. We all know people who have had it quite badly more than once, and we also know people who have not had it badly at all.
Yeah,
there's no explanation for that, and I think it's time the government had the data to be able to explain why it is that some people are affected more than others.
I seem to have asbestos immunity shield to COVID, so we'll
Yeah.
see. But apparently, according to a range of studies, 20 to 50% of people may have T-cell protection from coronavirus.
And that's been quite current this week.